Welcome to Advocate Today. I'm Aaron Dean. The FDA is taking steps to make it easier to understand how to safely take prescription medicine. And to do that, they are proposing a one-page guide that would include the drug's name, its use, safety information, common side effects, and directions on how to take it. The FDA says nearly 75% of Americans have had trouble taking their medications as directed, and using medication incorrectly contributes to nearly 25% of hospital admissions and approximately 125,000 deaths each year. The FDA is asking for public input on the proposal during the next 60 days before finalizing the rule. Big Pharma is once again at the center of an opioid settlement. Members of the billionaire Sackler family will be protected from current and future lawsuits over their role in Purdue Pharma's opioid business. Purdue Pharma first introduced the opioid drug Oxycontin in the 1990s and promoted it as non-addictive. Dee Yodler, who lost her son to opioid addiction, says that the settlement is a small victory.
I'm feeling basically relieved and pleased that it has gone through. I mean, of course, nothing is ideal in this sort of situation, but I think it is the best that we could have gotten. The alternative would have been thousands and thousands of lawsuits that could have gone on for years and years, and I just don't think that would have helped anything. I mean, I hate to sound like I'm agreeing with the Sacklers, but I do think I'm pleased that it's happened.
Purdue Pharma has been accused of helping to fuel the opioid epidemic in the United States. Over 20 million people in America have been diagnosed with a substance abuse disorder. That's according to the National Institute on Drug Use. Addiction and abuse are rampant in the LGBTQ+ community, with 20 to 30% of queer people abusing substances, according to the Addiction Center. That's compared to 9% of the general population. I spoke with addiction expert Dr. Lucas Trautman about the challenges the community faces and finding hope for recovery. Dr. Trautman, can you kind of explain a little bit how the obstacles in today's society, how it impacts the LGBTQ+ community when it comes to having these higher rates of substance abuse compared to the general population?
Sure. So we call this multifactorial. We had a perfect storm of COVID, social isolation, all kinds of additional financial stressors in our community in America that just sort of everyone faced. And then at the same time, we see a media campaign, social media campaign from some outlets who've seemed to demonize members of the LGBTQA community. So with the additional stressors, the isolation, comes sometimes dysfunctional coping through substance use, whether that be alcohol, whether that be opioids, anything to try to help put the flames out on that anxiety. The LGBTQA community have seen so much of that, as you know, and I believe that's where a lot of it comes from.
And, with your background in addiction psychiatry, what are some of the specific factors you believe contribute to the high rate of substance abuse among transgender individuals specifically?
There's a real physical threat to their safety that I see here at the treatment center where I work. Oftentimes when we have trans individuals come in, they have a history of abuse, violence, personal injury. And so that just on its face alone creates a system of trauma that can increase the risk of substance use. Not to mention the sometimes shame and societal isolation that can cause increased stressors, which would lead to substance use as well, higher in that community.
And, when we think about statistics, when we think about numbers, are there any statistics that just really stick out to you that you're just like, whoa, I didn't realize this?
Yeah, and there are faces in my mind with these statistics, and while I can't give you an exact number, the suicide rate amongst transgender teenagers is very, very high, just so unacceptably high. And I know many of these young people and knew them, and so you asking me that question jogs very personal memory of people that really good souls that we lost.
Like you're saying, like, these numbers, these statistics have faces. They have stories that, that they lived or that they're currently living. And, of course, like we were saying, like, addiction impacts them. But when we think about like the outside group, like their family, their friends, how can they play a part in helping, people get through these tough times? How do they create these safe spaces for them?
Yeah, I think it's a personal choice on how to nurture and care for your tribe. I have a family member, really conservative family member from a U.S. military Marine Corps family, has 6 kids, and one is transgender. And you would imagine this family is in Virginia. Again, just tons of service, very conservative family. But when this young man came forward and shared this with his family, um, my family member, she said, "This is my tribe, and Mama is doing everything for their tribe." So we see families with a choice. We sometimes families are confused and they don't know, and they have fears, and they fear that the child will be bullied or harmed or whatever else the fear is. They have a choice. Do I fiercely defend my tribe? Am I that kind of a mama? And I see a lot of mamas out there, including my family member who is. I mean, she still rolls with her very conservative peer group, but that is her boy. And that is her tribe. And she's very vocal and verbal and in the advocacy for his journey. And I think that example can be generalized to the community. You may not understand 100% what's going on, but you have a vulnerable member of your tribe, of your team, and you got to be there, and you got to love, and you got to show compassion and support. Because if you don't, then perhaps no one else will, and there will be a suicide risk.
And when we think about like effective strategies and interventions that can help, what are those effective strategies that you know of professionally that will help marginalized communities?
Right. So if there's a substance use history, getting them into treatment, because while substance use is a remitting, relapsing chronic disorder, sometimes treatment works. And so, for example, if someone's using opioids or alcohol, we get them to a residential treatment center. They get really amazing, empathic, informed care, and by board certified people such as myself. We meet them where they're at. We medically get them, away through their withdrawal management, away from the substance, and then teach them tools to help prevent relapse in the future. And so just the treatment process, going from residential treatment to intensive outpatient and then back to the home community of outpatient, it can be very, very, very effective. It's a whole world of treatment that can help people.
And through your time, professionally, what are some of the gaps in our healthcare system that you have found that need to be closed up so that marginalized communities can get the help that they need when it comes to substance abuse or mental health?
So this is just in general lack of relationship. When we saw with COVID more isolation, everybody retreated to social media, and we saw less conflict resolution through relationships, and so people really capitalized that and were able to demonize each other. I would hope that in my physician community, my peer group community of physicians, that we would continue to build relationship across cultural lines that help inform the humanity of the other person, of the patient we're treating. And if we live in a community that lacks that diversity, then it's upon us to do the education and the research and the continuing education to get that. For example, if you work in the community of veterans and you're not a veteran yourself, or if you work with active duty military at the VA, for example, and you don't know any active duty members in your personal life, it's incumbent upon you as a physician to really get out there and educate yourself so you can be super competent. Implicit bias.
And that's all the time that we have for this advocate today. I'm Aaron Dean, and we will see you next time.